Serving 885,000 people, Island Health's focus is the health and wellness of the residents and communities on Vancouver Island and in surrounding coastal communities. Our diverse geography spans 48 settler communities and 50 First Nations, from the Zawadenu people of Kincombe Inlet to Victoria, from Tofino to Comox. We acknowledge with respect and gratitude our privilege to provide health and care services on the traditional unceded territories of the Coast Salish, Kwakwakiwak, and New Chalneth cultural families. The Island Health family includes 30,000 healthcare professionals and 1,000 dedicated volunteers. Over 3,000 doctors, nurse practitioners, midwives, and dentists make up our medical staff. We provide health and care services at 145 facilities with more than 6,700 long-term care beds, over 1,600 mental health and substance use beds, and more than 1,800 acute care and rehabilitation beds. Island Health has an annual budget of $3.9 billion. Each year, this funding supports 561,000 visits to emergency departments, more than 73,000 surgeries, nearly 60,000 MRIs, 158,000 CT scans, 2,100 telehealth visits, more than 85,000 visits to urgent and primary care centers, over 17,000 home health monitoring visits, 314,000 visits to ambulatory clinics, and 478,000 home health care visits each year. Island Health has expanded our primary care services with 23 primary care sites across our region, including 7 Island Health urgent and primary care centers and 9 primary care networks. Under the leadership of 6 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 500 inspections of licensed care facilities, and 5,400 inspections of food service operations. Our public health nurses provide nearly 6,000 perinatal home care visits and 30,000 childhood immunization appointments. From birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
Good evening, everyone. Can you hear me okay? Excellent. I'm Leah Hollins, the chair of the Board of Directors of Island Health, and on behalf of my colleagues, welcome to our public forum, whether you are joining us in person here in the Kwalilas Hotel in Port Hardy or online through our live stream. I acknowledge and pay respect to the traditional territories of the Kwakiut Nation, and I also want to recognize the surrounding coastal communities of the Kwakwakiwak Nations. I am grateful now to introduce Hereditary Chief Calvin Hunt of the Kwakiut First Nation, who will start our meeting with a welcoming message. Chief?
Yo, Gaelicasla. Actually, my hereditary chieftainship comes from the New Chalneth, from the Mowachat Machalat. I carry my grandfather's chieftainship, Dr. Billy, who came from Uquat, also known as Friendly Cove, and I'm also a Kwagil chief as well. I would like to welcome you to the traditional lands of the Kwagil. We're the smoke of the world. When the Kwagil started potlatching in the wintertime, potlatch times, they believed that the smoke from their houses traveled around the world, and everybody knew that we were celebrating. I'd like to sing a chant to our Creator, to ask Him to bless this day, what's left of it here, Usually this is something that would be done in the morning, but I think it's appropriate for this gathering here. Wei, Gelikas la all my relations, glako cho.
Thank you, Chief. We very much appreciate you being here today, and I'm grateful to you for welcoming us as visitors to live, work, and care within your traditional and unceded territory. I also recognize the Inuit, the away-from-home urban Indigenous people, and the Métis chartered communities. We do this to reaffirm our commitment and responsibility to improving relationships between nations and cultivating our own understanding of Indigenous peoples and cultures. Please join me in reflecting on the harms done, such as the cultural genocide and assimilation of Indigenous people, the Indian hospitals, the residential school system, and discovery of graves of Indigenous children who attended them, the too many missing and murdered Indigenous women and children, and the social inequalities and racism which exist today. I invite you to think about our responsibility to act in a spirit of reconciliation, healing, and collaboration. As a healthcare organization, Island Health is committed to cultural safety and humility. We demonstrate this through our actions to address Indigenous-specific racism, systemic racism, and the ongoing impacts of colonialism. Public forums like this allow the board to meet the people and communities we serve and are essential to our commitment to transparency and accessibility. Our time together will help us better understand what matters most to you, so we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. The Minister of Health appoints the board, but we each choose to sit on the board because we care deeply about health and care. As a former nurse, a Deputy Minister of Health, and Chair of Canadian Blood Services, the patient has always been central to my work. I always ask myself, is what we are doing right for the patient? Caring for patients is why I started working in healthcare. Caring is also why every member of Island Health's family is dedicated to delivering Island Health's vision of providing excellent health and care for everyone, everywhere, every time. It's now my pleasure to introduce you to our board of directors. In addition to myself, the board includes Andy Adams from Campbell River, Shawnee Cassavant from Hupetchesset and Sayshot First Nations on the West Coast. Thank you. Ron Rice, a member of Cowichan Tribes who lives in Victoria. Diane Brennan from Nanaimo. Ann Davis from the Comox Valley. Ann McFarlane from Victoria. Ron Matson from View Royal. And our newest board member is Harold Cull from Colwood. Our local leadership and executive management team members are also joining us tonight, and you will hear from some of them later on. We have a very full program, as always happens when we are in communities. And so Dr. Charmaine Enns, our medical health officer, will speak about regional public health and wellness. Then we have a presentation from Marjorie Greensides, the coordinator of the Mount Waddington Health Network. And the last part of the agenda will be an opportunity for you, community members, who have come to our meeting or submitted questions by email in advance. I will open the floor to questions so the board can hear from you. But first, Island Health's President and CEO, Kathy MacNeil, will begin by providing an update on the delivery of health and care services across Vancouver Island and here in this region.
Thank you, Leah, and good evening, everyone. First, I'd like to thank the chief, who I think just left us, but I'm very grateful for his warm welcome and his song and to open us up in a good way for our time together this evening. I also want to acknowledge and pay respect to the traditional territory of the Kwalilas Nation on whose land we're visiting here tonight, and recognizing the surrounding coastal communities of the Kwakwaka'wakw Nations, Kwalilas, for your hospitality to us. I'm also glad and like to acknowledge and appreciate the members of the North Island Métis Charter community who have joined us here tonight, and all those away from home, urban Indigenous people and Inuit who may call this region home, and the commitment, as Leah said, we make to deliver culturally safe health and care. Thank you to all of you who've joined us here this evening in person and those online. Thanks for taking the time on a beautiful, hopefully summer evening to have this conversation with us. As always, I'm really grateful to be here in the North Vancouver Island, and particularly here in Port Hardy. Whenever I get the chance to come to this region, I'm struck by the diversity of the island, just driving those 7 hours from tip to tip, and the tranquility of the region here and the space that you call home. The unspoiled wilderness serves as a perfect setting for outdoor adventures and the opportunity to stay grounded with the nature all around you. And that nature is so important for health and well-being and wellness. It's also good for your blood pressure too. So you're surrounded by some of those ingredients for good health. We recognize at Island Health that there are challenges with accessing care in remote communities, including the community here in the North Island. The impact of not having 24/7 emergency department coverage in Port Hardy and on Cormorant Island is a critical issue for you, and it's also a critical issue for us. We hear that from your local mayors, your MLA, and our own staff. We hear that on a constant basis. I want you to know that we do hear those concerns, and we are working very hard with our team to address those issues. Recruiting physicians and healthcare workers across Vancouver Island is complex. Every community has its own unique needs, and we know how it's felt acutely here in the North Island. As you saw in our video, our goal, our vision, is to provide excellent health and care. You deserve high-quality care. With government support and investment, we are strengthening support and services, including efforts to recruit and retain those desperately needed healthcare professionals that we all rely on. In January of last year, the Ministry of Health announced $30 million in funding for capital and operational improvements in the North Island. This funding has been crucial to helping us better meet the healthcare needs of the residents here. I'll discuss some of the investments shortly, including our recruitment efforts, the hiring of nurses and physicians, improving transportation between healthcare facilities, and upgrading staff accommodations that has begun. Some highlights from these investments include providing better access to imaging with the addition of a new mobile CT scanner here in Port Hardy, which means residents no longer need to travel to Campbell River or beyond for non-urgent scans. Increasing the safety of patients and staff by adding 24/7 protection services officers in our hospitals here in healthcare facilities. And I got a chance to meet Leon today and hear about how proud he is to do the work that he does here in Port Hardy. Also supporting much needed infrastructure upgrades at both Port Hardy and Port MacNeil hospitals. Improving access to sobering and assessment services by adding 6 more beds and having them accessible around the clock 7 days a week. Expanding long-term care with the addition of 4 long-term care beds here at Eagle Ridge Manor. For some time, we've had physician and nursing shortages at our hospitals and health centers here in the North Island, impacting people's ability to access the care they need when they need it. We are committed to maintaining that access to emergency departments for people living here in this region. We launched a comprehensive national recruitment campaign to attract a diverse range of potential new team members here in the North Island and in other areas across Vancouver Island. I'm pleased to share we've made significant progress in physician recruitment over the last year, and yet we recognize there's still much more to do. Since September, 5 new physicians have been living in North Island. They're practicing in Island Health facilities and in private clinics. I got a chance to meet Dr. Ramiz Al-Hadi today at the hospital here in Port Hardy, and got a chance to talk to him about his experience coming to work here. The addition of these physicians will help ensure residents get the care they need when they need it. We're grateful for their service and welcome them warmly to the community and to the Island Health team. Dr. Evan Rogers has assumed the Chief of Staff role at Port Hardy and Port MacNeil hospitals. I want to thank Dr. Rogers for his interest and leadership, and I'm looking forward to meeting him and hearing his ideas for improvement. We've created a dedicated medical leadership role for Cormorant Island Health Centre. This medical director and chief of staff position is currently posted, and we're accepting applicants. So if you know anyone, please let them know we're hiring. We, along with the Ministry of Health, the Family Practice Service Committee, and the Doctors of BC, will continue our efforts to recruit and retain physicians in this area, focusing on practice support and compensation. We've been also working very hard on recruiting registered nurses to this region. Since January, we've hired 4 registered nurses at the Port Hardy Hospital, including 1 new graduate, and 3 registered nurses at the Port MacNeil Hospital, including 2 new graduates. And then we've also hired 4 on Cormorant Island. We have currently several potential registered nurse candidates in various stages of the recruitment process, including some who have received job offers. One of the significant challenges that our new recruits are facing is the ability to find affordable housing, not unlike others who are moving to the region. We've been working on improving staff accommodations to retain and recruit the workers we need. Existing Port Hardy and Port MacNeil staff accommodations are being inventoried, refreshed, and modernized with new furniture, and additional modern housing has also been leased. Island Health and the Namgis Business Development Corporation partnered in December of last year to increase housing availability for healthcare professionals in Alert Bay. The Namgis House is a brand new 3-bedroom house owned by Namgis BDC and leased by Island Health. It provides temporary accommodations for staff working on Cormorant Island while they look for a place of their own. We've also signed a contract with Kawatsi Construction to build 10 2-bedroom staff units here in Port Hardy. These housing initiatives, developed by local First Nations and Island Health, are remarkable solutions that address the critical need for housing and boldly tackle healthcare recruitment challenges. It demonstrates the potential that can be realized when communities collaborate to meet the essential needs. It also reflects our commitment to enhancing the health human resource capacity and continually adjust to evolving workforce requirements. As I mentioned earlier, we are working to upgrade and modernize the Port Hardy and Port MacNeil hospitals. Community members and staff have identified existing spaces such as the maternity and emergency departments, trauma and nurses stations, and the sacred spaces that are much needed to be renovated. We're just finishing up our cost estimate phase for these changes. Next, we'll move on to the design phase for both hospitals. There are some terrific renderings of what the upgrades could look like here in the room at the back of the room, and we're very excited to see these improvements become reality. I hope you have a chance to take a look at them, and we have our team who are working hard on this project available there if you have any questions. We've heard of the challenges that citizens experience with respect to transportation to our healthcare sites, and this can be particularly challenging in rural and remote areas. Last year, a shuttle service was established between several regional sites as part of our commitment to improving access to services here in the North Island. This includes daily return trips between Kwalilas Health Centre and Port Hardy Hospital, and shuttle services between Port Hardy and Port MacNeil hospitals and the North Island Hospital at Campbell River. From April of 2023 to the end of April of this year, we transported more than 1,000 patients and support people and 173 staff between these sites. The shuttle has increased access to services like non-urgent x-rays, which were previously only available 2 days a week at Port Alice Health Centre. We also know that, like many communities across the island, community members here are struggling with mental health and substance use challenges. The toxic drug crisis has had a devastating impact on so many communities across the island, and I know it's been particularly distressing here in your community. A group of First Nations, including the Kwalilas, Kwalilas, and Quatsino First Nations here in Port Hardy, called a state of emergency due to deaths related to mental health and substance use in recent months. In response, the nations established an Emergency Operations Center, or our term in healthcare, EOC. Island Health and First Nations Health Authority responded and played a supporting role, responding to the needs identified by the nations themselves. Through this partnership, the EOC has made exceptional progress in a short period of time. Although the EOC structure has formally been stood down, work continues between the health authorities and the Indigenous communities. New partnerships have been created through this approach, and existing ones strengthened, resulting in newly established processes and structures for communication and coordination of services and supports. Because of this work, 3 new coordinator roles, one each within the nations, First Nations Health Authority, and Island Health, have been created. Moving forward, these coordinator roles are intended to provide an ongoing connection to identify trends, successes, and opportunities to fill service gaps, ensuring community needs are met in the same timely and respectful way they were when the EOC was active. The work done with the EOC and the nations has also seen the creation of a new crisis line and the education, training, and recruitment of additional staff to the nations to help respond to the overdose crisis. We're also working with the nations to assess service gaps and ensure we're working collaboratively to bring mental health and substance use services to the community. Island Health will continue to stand alongside the nations and the First Nations Health Authority, and we will continue to take their guidance to ensure that support and programs are informed by their community health expertise. We know our community partners are also making large efforts to address mental health and substance use challenges in various island communities, including Port Hardy. As a contracted service provider for Island Health, the Salvation Army has expanded sobering, assessment, and sheltering services here in Port Hardy, operating those 12 beds 24 hours a day, 7 days a week. The program receives support from our mental health and substance use team, BC Housing, the District of Port Hardy, and the Mount Waddington Regional District. Free local drug checking services are now available in the Port Hardy area to help decrease unregulated drug overdoses and save lives. A new spectrometer has been installed in the Mental Health and Substance Use Office downtown here in Port Hardy, allowing substances to be checked for unwanted and unknown contaminants. This provides a valuable harm reduction tool, giving people the ability to understand what's in the substances they plan to take. This is a challenging time for communities, including Port Hardy, when it comes to issues related to people who are unhoused and struggling with mental health and substance use. And we know the solutions to this specific challenge are complex and require partnerships across agencies, across organizations, and with the community. We'll continue to work with local First Nations and community partners to address these issues and look for solutions to help those most in need. As you saw, our vision at Island Health is to provide excellent health and care for everyone, everywhere, every time. It serves as our North Star. It guides the hardworking and dedicated Island Health teams in their daily work. Local collaboration and partnerships make a tremendous difference in realizing this vision. Our teams appreciate the support and interest of the community in their work. I specifically want to thank the health directors of the local First Nations, Caitlin Hartnett of the Kwalilas Nation, Rosie Dugas of the Gwaxala-Naquada Nation, Jen Nelson from Quatsino, Kelly Speck from Namgis, and Georgia Cook also from Namgis. They're critical partners in this work to us. I also want to thank the local municipal leaders and mayors for their continued partnership and collaboration. In particular, Dennis Buchanan, the mayor of the village of Alert Bay, Pat Corbett-Labatt, the mayor here in Port Hardy, and James Fernie, the mayor of Port MacNeil. And most importantly, I want to express gratitude and appreciation to the dedicated staff and medical staff who offer their skills and talents to these North Island communities. We are all so tremendously grateful for you. I speak for my leadership colleagues when I say how grateful we are for the partnerships and the collaboration, and how proud we are of this team that serves the health and care needs here in North Vancouver Island. Gaila Kesla. This ends my report to the board and community, Madam Chair, and I'll return the meeting back to you.
Thank you very much, Kathy. I'm now very pleased to introduce our Medical Health Officer, Dr. Charmaine Enns, here today to provide an update on the health and wellness of the North Island population. Dr. Enns.
Thank you very much. I'm just going to get permission from the sound people. I can take the mic out. Anybody have a problem with that? Okay. I don't have anything on the podium, and I have to see what's on my screen. So good evening, everyone. My name is Charmaine Enns. I'm the public health physician, or the medical health officer for the region, for actually the top half of Vancouver Island. And I've actually just had my 21st anniversary of being an MHO for North Island, so I'm pretty happy to be here. Yeah. And I'm only 30, so... I also can't start without expressing my deep and profound gratitude for meeting on this special territory, the home of the Kwalilas people. So thank you very much for your welcome and your embrace to let us meet and gather here together. So I'm going to give a quick snapshot of some health statistics for the region. And I just know that that's challenging when it's from a pretty high level in terms of a population story, and not everybody will feel represented in that story sometimes. So I just want to recognize that this is a population level conversation. Next slide, please. So we can just go on to the next slide, since I only have 10 minutes. Okay, this is actually it's fairly young. The population is fairly young in Vancouver Island North, with median age of being 44 years of age. 22% of the population are people under the age of 19. And it's a growing population. It's expected to grow by at least 13% in the next 20 years, but half of that population growth is in the over 65 age group. So it's an aging population as well as a growing population. Next slide. This is unfortunately not a great news story, but the life expectancy in the region is challenged. So the life expectancy, which is it's an average of everyone in the region from birth to when, on average, what people would live. You can see the yellow line is for this region, Vancouver Island North, and the top line, this is for British Columbia, this is for Island Health as a whole, and this is for this region. This here says 82 years, this is 81 and a half, and this is for 77. You can see there was a decline in all areas of BC and on the island throughout the years of the pandemic, not because of COVID, but because of other related impacts from COVID response. Some of it was COVID, but that's not what contributed to what's so obvious on the chart. This is something that obviously is a concern for us that we have to pay attention to, and we're going to get to some of the things we can maybe do about that. Next slide, please. So I want to try to be really positive because I love this area of the North, and there's just so much good happening here with so many good people and so much resiliency. And so there's also other good news. So unlike other communities, we are seeing that housing has become more affordable in the region, not only for those who own, but for those who rent. And we're also seeing that the number of children who live in low-income households has decreased over the last 5 years. So there's improvements across those financial brackets. Next slide, please. So I'm doing something a little bit different, board, than I normally do, and I'm focusing in my last bit of the presentation on children and youth, because that's our future and that's our hope, and I think we've got some really good stories to tell for kids and youth in the region. So next slide. And we're going to talk, next slide, we can just jump right to student safety. So when kids were asked, do you feel safe going from home to school or school to home? 74% of elementary students and 78% of secondary students said yes, we feel safe all of the time or most of the time. This is the highest positive survey response that's ever been received. So this is really good news. In terms of not only it's the best, it's a good percentage, but it's also a very high rate compared to what was recorded 5 years ago. Next slide. Self-reported health. When kids were asked, how do you report your physical health? Elementary students said 75% of them said their health was good to excellent, and 63% of students rated their health as good to excellent. That's very consistent with the rest of the province. Next slide. Early education indicators. So when you look at grade 4 students for literacy, so how they can read and how they can do, so reading and arithmetic. And the percent of grade 4 students on Vancouver Island North that are meeting or exceeding this is going up and trending up. So 83% of kids grade 4 are literate, and 71% are doing great in math. Why I love this slide is because this also, these numbers also are meeting and exceeding the rest of British Columbia. So something really good is happening here for elementary kids. Next slide. Positive wellness in positive childhood experiences. So the things that, even for kids who have a lot of challenges by no choice of their own, if they have some positive experiences or buffers in their life against those challenges, they can overcome and succeed. And so those positive childhood indicators are things that how many have it being loved and accepted by an adult in your home, feeling that you can talk to somebody in your household and they'll listen to you and care about what you have to say. The indicator of any single adult that they trust, either inside or outside of their family, just having one adult in their life that they trust can make all the difference in what happens in a kid's life. So when we look at these positive, resilient indicators for kids, and what that can mean in terms of protecting them against challenges, because we will all have challenges we need to deal with. For here in the region, 71% of the youth that were surveyed said they, which was a pretty good percentage, felt that they're respected quite a bit or very much in their household. 65% of youth said they can speak at least a few words of an Indigenous language. So having cultural or traditions that identify where you're from and who you are is a very protective factor. And then I just want to highlight 89% of students said they feel safe often or always inside of their home. So this, again, from a population level, these are very encouraging. This is a very encouraging story to tell. Next slide. But we also have some challenges within the region, so we're just going to quickly touch on those. Next slide. So why am I bringing up climate change? Climate change is because that's kind of a big deal for everybody, everywhere, and none of us can escape it. So this here is the 2023 drought levels on Vancouver Island. This here is for Vancouver Island North. And you can see here, when you look at the map, this is just from June to the middle of July to October last year. And the darker it gets means the more drought there is. So over a course of months, we went from everything being no impact at all to very adverse impacts for certain. And so that you can see that all of Vancouver Island had that impact. So why am I bringing this up? Because the way we talk about climate change and the way we address it is so critical because our young people are feeling a sense of hopelessness with all of the negative talk about the world is doomed and falling apart. I don't know how else to say it except we need to be able to empower our youth that we have something we can do about this. There is power, you do have power, and we need to give them hope for the future, how we even talk about and address climate change. And part of that in our communities is how we adapt. So we need to adapt, let's not fight it, let's just adapt, and then that will also build in quite a bit of resiliency and hope for our youth. My husband says I'm bossy. Am I coming across bossy? I'm sorry about that. Next slide. The economic opportunities are a bit challenged in the region, so that Vancouver Island North has the lowest median after-tax income compared to other areas. It's the reality, but that doesn't mean that's not an opportunity. Next slide. I have to talk about alcohol. I'm talking about alcohol in every community I can get into within all of the areas that I have responsibility for. So alcohol consumption is a phenomena that has of increasing trends in consumption across all of our communities as a result of the pandemic. Things got way worse. But I just want to show you that alcohol consumption in this region compared to Vancouver Island compared to the rest of BC, and that actually comes down to 900, so for everybody in the region that's 15 years of age and older, if you took everybody in the population 15 years age and older, and then all of the alcohol consumed in 2023, it averages out to 906 standard drinks per person per year, which is 17 standard drinks per week. We have new guidelines in Canada for alcohol consumption to limit the risks from alcohol, because we know alcohol is a cancer-causing agent as well as causing other health risks. The recommendation to limit your risks is two standard drinks per week, and within the area, the average consumption is 17 standard drinks per week. We know that most of the population doesn't drink the average, but that means of all the people who don't drink very much, that means there's somebody that's consuming that amount somewhere else. The good news in this is that when the youth are surveyed, we're seeing decreasing trends in psychoactive use. So that includes alcohol. So in the last 5 years, young people are drinking less alcohol than those surveyed 5 years ago. They're smoking less, they're not initiating tobacco, and they're also not initiating cannabis at the same rate as they were 5 years ago. Even though cannabis use amongst youth is going up in the rest of BC, it's not within the region. Next slide. And the other indicator of concern was youth bullying, in that North Vancouver Island students, Vancouver Island North students were reporting bullying more frequently than in other Island Health school districts. So this is Vancouver Island North, and this is just by grade. And so you can see overall, compared to the other school districts, more kids are reporting feeling bullied at school. Next slide. And youth mood and anxiety. So just to say, again, this is for kids, youth, young people under the age of 19. And the rate of kids that are reporting anxiety and mood disorders, and it's increased. It's increased well from 2013 to 2018 by quite a bit. So we saw the slide where kids are reporting physical health as good to excellent at quite a high rate. They're not reporting that for mental health, and that's a really important indicator for me. The other thing that's I think important is something as basic as sleep. So within the area, 1 in 10 youth, only 1 in 10 youth are going to bed and turning off their phone when they go to bed. 9 of 10 youth are still using their phone when they're in bed and is their time to sleep. And so the rate of kids that are getting 8 hours of sleep has dropped down to less than about 40%. So the phone is a big deal in terms of sleep. Why is sleep important? Sleep has a lot to do with our health and our well-being, but also it affects mood and anxiety. Next slide. So we got lots of opportunities to work on going forward together, but we also have lots of good places to start from where things are on a trend that are improving and are very encouraging. So I just listed this as just a summary from the slide, but I just feel encouraged. I feel encouraged about what I'm seeing over the last number of years within the area, and again, but I'm not naive. I also recognize there's still tons to work on together. So I want to thank you as a community for being experts on your health and wellness, and for your love for your kids, and for wanting the best for them. And that's it. Thank you.
No, not for that. I can just use the mic
For that. Okay.
Thank you very much, Dr. Enns. One of the things that always startles me when we listen to population and public health that Dr. Enns talks about is how each and every one of us can do something about it. And we all need to take responsibility for ourselves in terms of what Dr. Enns has just talked about. So thanks, Charmaine. And now we're going to move to a presentation about the work of Mount Waddington Health Network and what they are doing to promote health and wellness in the region. This is the point of the meeting when I ask my colleagues if they have any questions after the presentation. So don't be surprised if I ask my colleagues if they have questions and I don't turn to you just yet. But after that, we will have audience questions as well. So our presenter tonight is Marjorie Greensides. And Marjorie, please. Thank you.
Good evening, everyone. Thank you so much for taking the time to come out tonight, and I'm excited to share some information with you. First and foremost, the Health Network would like to acknowledge that we operate in the entire region, which includes all the Kwalilas speaking people, Kwalilas for allowing us to be here, and of course to the Kwalilas today on whose lands that we stand. So we are so grateful for the love and care of this land since time immemorial. And as someone who came from here for 6 months, 34 years ago, it's a place that truly captures you. And once you are under its spell, you can't but love and honor it at all times. So, Gillicasla, next slide, please. So the motto at the Health Network is healthy people, healthy communities, and we strive to be a positive community-centric network of health-related organizations, community members, First Nations, local and regional governments, and we get collaborate and share ideas and resources for the betterment and health and wellness for all of our communities. What does that mean? Well, one of the primary roles for the Health Network where there's a lot of benefit on a quantitative level around just allowing and bringing together groups of people. Most of the work that gets done, as we know, starts off as little side conversations. So creating a space where those side conversations can be engaging, but also including a really broad spectrum of community to really ensure that as many voices as possible have a place to share what they need within community and within their wellness. Next slide. So our mission is to use our collective knowledge and goodwill to improve the health status of our residents and to reduce health inequalities. These are not easy tasks. And there are many, many of us doing amazingly good work, not only here on the North Island, but across the island in general. And I think it's important that we recognize the complexity and the difficulty within that, and there's going to be bumps and bruises along the way. So how do we ensure we're creating spaces for people to feel safe and still know that there might be some obstacles that have to be overcome? And how do we create spaces to ensure those conversations can happen even when they're difficult? Excuse me, next slide. So the values of the Health Network, inclusion, diversity, fairness, collaboration, time, transparency, and in gathering, we strive to provide a positive, universally respectful and culturally safe environment. Now, you know, one of the things that I want to tote health networks for just a moment around these values. So there are health networks across the entire island. And their work is based on what are called the 12 determinants of health. I'm going to admit it, I cannot rattle all 12 off at the top of my head. But what's important about those is they are truly a broad spectrum of the things that impact our lives, right? So it's not just primary care, which is crucial, but it's what are our living standards? What does our economics look like? What does our fun look like, right? Like those things are important. Those qualities of life and those moments that bring us joy are equally as important. So, you know, and when speaking with my Health Network colleagues, so we're all basically part-time contractors, and we could do so much more. The ability to bring people together, and one of the other beautiful things about the health networks is there's a certain level of autonomy that exists. It doesn't lack accountability, but health networks really do have the ability to respond to their local needs, right? So what you see happening in Port Alberni, Clayoquot, Health Network is going to look different than it does in Mount Waddington or down in Victoria, which also has very different needs than up here. But the health networks are a lovely agency in that they have the ability to take that information and pivot on a dime if need to. If there's something going on, communities needing support and communities expressing that desire, we can shift to do that. And that's a really unique position to be in. So many agencies are confined so strictly by their policies and processes and procedures that the ability to pivot doesn't always happen in a time frame that makes sense. So next slide, please. So what are we focusing on? So I'm still sort of new in my position. I've been doing it about 9.5, 10 months. And so we're still redefining, again, to answer community need, where we want to go and what we want to do. But there's some basic stuff. So in the downtime between coordinators at the Health Network, some of our committees have fallen a little to the wayside, so we really want to revive a number of those and breathe new life into that. We want to do as much collaborative work as possible. Health Network truly believes that the best way to do things is do things together. And as people know up here doing the work, there's a lot of work to be done, and we're all pretty taxed. So the more that we can do together, the better the region as a whole is. One thing that we will be doing yearly, so we have just finished this, is maintaining a housing survey for the entire North Island, including all of its communities. And this information is available to any group or agency here on the North Island, right? I don't think we need to get into the big debate about how important housing is. Data matters. So, and then we want to expand our regional capacity through workshops and learning opportunities. We are a geographically ginormous region, which makes certain things a little difficult. However, everyone's capacity is built through enhancing our skills, identifying new training opportunities, and so how do we bolster everyone up in community? This is a great opportunity to do that. Next slide, please. So one of the primary things that the Health Network does is we maintain a table of partners. And the table of partners provides leadership and oversight. It serves as a liaison between the Health Network as well as all the local agencies and community. We focus on the 12 determinants of health. We make change by continually assessing the health issues of our community. And again, here's that pivot piece. By keeping a finger on the pulse, we can pivot as needed. And again, collaboration, right? So how do we develop and implement strategies and resources that better meet the needs of all of our community members? Next slide. So at present, these were the existing committees. We have one for seniors, child and youth, food security, cultural and inclusion, health services, wellness, and of course our executive committee. Pretty standard committees. So, but all focused on areas that, again, are related to the 12 determinants of health. Next slide. So I had mentioned our survey, so we have just completed that. So we now have data for the region from 2022, 2023, and now 2024. It's still in its raw stage, and I apologize. I would have liked to have presented that information. But this is a priority for the Health Network. And in this year, we added another component was added to ensure it was meeting the needs of BC housing. So, yeah, I will be happily sharing that with everyone once it's all complete. So next slide, please. One of the things that we just did recently is we held a World Cafe Wellness Forum. So this was looking at, given the extra strain, shall we say, that's been put on our local communities of late, given some of the crisis situations that we've had, we were really trying to look at a way to provide educational opportunities, but also wellness opportunities for our social service providers here, right? There are amazing people on the North Island doing amazing work, and it can be exhausting. And so trying to find a space where we could honor them, celebrate them, and provide them with a little care. So we had 9 educational workshops on things like trauma-informed nutrition, how to age well in community. And then we had some healing workshops. So we had a sound healing workshop, and we had an expressive arts workshop, and we had some chair massages and some reflexology. So there was this real combination of different modalities as well being presented. And then on the 3rd day, we did the Shift BC workshop around the radicalization of violence, which was, well, I'll speak a little personally here. It was a little different than I expected. The conversations were hard, and they were so inspiring and enlightening around how do we recognize in community as early as possible people that are struggling and struggling to a point where they actually might lash out because they feel unheard, they are not feeling seen, they don't feel like they have any kind of voice, so they create voice, which often is not in the way that reaches positive outcomes necessarily. So again, from a personal perspective, this workshop really, I went home and thought about it for a couple days, and I know it will definitely impact my practice from here on in. And over the course of the 2 days, we had about 150 participants. So overall, a great success. Lots of learning opportunity as well. We got some great feedback. I think we will be moving forward again. And thank you to Island Health for community wellness. Which, a shout out to that program, by the way, your community wellness grant program. It's a really great program. Yeah, so next slide. Just a couple little shots, you know, like we had some people showing how we can prepare like quick and easy meals that are actually good for our mind, body, and spirit. Trauma-informed nutrition, we had a lady presenting eccentrics, which is a type of exercise that can meet anyone's mobility needs. So again, just really trying to provide as many opportunities for exploration on how we can be well. Next slide. So how can Island Health strengthen its community relationships? I'm going to talk about communication for a second. And so one of the things that I love about my job is I get to interact with social service providers, and I also get to interact to community. And I get to listen to community. This is one I hear a lot, that our local communities really struggle to find the locally relevant information from Island Health. And I'm going to use your transportation schedule for the interhospital links as that example. So here's this great program. So many people need to access it. I seek out information constantly. It's what I do. I'm an information junkie. I like to know stuff. I could not find it. I spent hours. I was fortunate that it was emailed with me, so I was able to share it. But again, so here's a schedule that nowhere online or within the social media platforms could the public access this information. The public couldn't find it anywhere. And so, you know, again, just reflecting on that, how can Island Health ensure that the communications are getting out to the actual local communities about very specific things? Does a great job at the upper level stuff, the on-the-ground stuff, you know, and with all of the amazing work that's going to be happening over the next couple of years with the hospitals and stuff, when that gets, community is already expressing a lot of concern about how are we going to access that information in a timely, easy manner, because it's going to be confusing. So, next slide. So capacity building and education, again, I touched on this, but what are the opportunities for Island Health? You have a lot of resources and training, and you do some educational outreach at this point, but I think there's a lot more room for partnership there. How many other educational opportunities can we bring up in partnership that enhance the capacity of all of the social service workers in our region? I'm getting fingers. Policy, local decision making, and access. So one of the things, and I mentioned this, that I love about the health networks is we have this ability to be flexible and adapt locally. And you know, this I think is another area where partnership can really be increased, and I think it can be built upon, as you were discussing, Kathy, with the recent changes in how certain situations were responded to, the processes that were developed around those that actually met that community need. And I think that's where we see the greatest successes, is when it's really grounded in that local community, and we're listening to the people on the ground and the local service providers and our First Nations who are the ones that are being impacted. We'll move on. Oh, I am going to do a little plug. When the MRI machine is finished and the new one's in Port Alberni, we'd love for the MRI machine to start coming here with the CT scanner. Okay. Next slide, please. Questions?
Thank you very much, Marjorie. Thank you for your work. Please just stay there for a minute, if you don't mind, because I want to ask my board colleagues if they have any questions for Marjorie. Ron Matson, you just need to speak, but you have to hold it quite close.
What's the one thing Island Health can do to improve the health status of the residents in this area?
Well, aside from sort of like all the obvious that, of course, the shortages, that kind of stuff. I'm actually going to really go back to that communication piece as a quick thought on the side, because in and of itself, even just trying to access healthcare, if that impediment is the initial response or block, I need to know this, but I can't find it anywhere, you've lost people, right? So depending on, you know, the crucial situation that's occurring around that person, they may end up weighing that if, again, accessing the crucial information is not readily available. The other thing that I would say, you know, it's hard when you're a large organization that has a huge area to cover to ensure that your systems and policies can really respond to the local communities. And so as an organization, I think ensuring that there are processes and places where your online frontline workers, whether that's in hospitals or within social services, mental health, really have the voice to help guide policy and procedure that meets the needs of the community. Because it is going to look different in Port Hardy than it is in Nanaimo, than it is in, you know, and the people that really know that information are the people that are there every day and are living it, right? So having space or some sort of mechanism where that is making its way up to the chain and being heard to impact local policy.
Thank you. Ron Rice?
I'm wondering actually, just on that last point, you know, we get a lot of information sent to us on a regular basis as the board, and I'm wondering if there is some sort of listserv that can be created in these regions and in these networks where sort of the 10 or 20 or 50 movers and shakers in the community can be given these updates on a weekly or monthly basis, and that you could feed back and say, these are the things that we're looking for going forward. But just thinking to the revival of your committees, I'm actually wondering about succession planning, just because, and I swear it's, ever since I turned 50, I'm finding myself saying, well, when I was young, but starting to think seriously about, you know, when I'm not here, where's the energy going to come from? And I think there are, you know, given the median age that Dr. Enns has just reported, there are a lot of young people in this area, and I'm wondering about that being part of your revival in the committees is the succession planning group who can start to feed the younger generation the history of everything that's been done and everything that's been tried and all of the things that are succeeding and why. Just an observation. Thank you.
And I agree, succession planning is incredibly important on multiple levels. I'm currently working on a succession plan for another organization I'm affiliated with. And it's a lot of work to do it, but the value in it, because not only are you capturing history, but you're creating and preparing next generations to take over. Yeah, super crucial.
Other questions from my colleagues? Okay, well, thank you so much. As I said, we really appreciate the work you're doing, and I see some of your colleagues in the room. Recognize them from the photographs, so thank you for doing that.
Thank you,
and
everyone.
thank you for being here. So the floor is now open for your questions to Island Health. Please keep your questions brief so we can answer as many as possible before we adjourn at 7:30. We also have, as I mentioned earlier, we have some folks online, and we've received some questions from the community. So I'll ask these between the questions that get asked in the room. So who would like to go ahead? We have a roving mic, I think, don't we, Mike? Thank you. John?
Thank you to all of the presenters. My name is John Powell. I'm currently the elected chief of the Mamalilakla First Nation, but I'm sitting here in the capacity of the First Nations Health Council. I represent all of the Kwak bands. And so I wanted to make a couple of observations and perhaps ask a couple of questions. One of the things that I really wanted to talk about was the stats that you showed at the beginning of the presentation. They look wonderful. The fact that you have 30,000 people, which probably is 6 times as many people as live on the north end of Vancouver Island, working for you. Obviously, it's a large organization. And the stats that you showed, although they look very good for Island Health, I wonder what those same stats are on the north end of Vancouver Island. And then you introduced your board. And there is no representation from the North Island on your board. And I think that that needs to change. People in the North Island, and 10 of our Kwak bands live north of Campbell River. They need services that they can't even dream of now here. I'm involved in the primary care networks, and several of them from Campbell River up to here. And although they're helpful, there are services here that people are still going to die in Nanaimo to use, like the dialysis. That's been something that I've been harping about now for some 10 or more years. People leave this community, and if you know anything about dialysis, which I'm sure you know, traveling down to Cumberland, or traveling down to Nanaimo, or traveling down to Victoria, and then getting back and then having to travel back down there. People live there and they die there, unfortunately. And they don't die there because they're not getting the dialysis. They die there because you disconnect them from their communities. And I know of at least a half a dozen cases in the Kwalilas and Nakwuktak where people have gone there and within a few short years they've died. And there really isn't anything wrong with them, but you've separated them from their communities that they've lived in all of their lives. This is something that you really need to talk about on the north end of Vancouver Island. And when we talk about the First Nations populations that are here, you need to talk about the people from Prince Rupert. You need to talk about the people from Rivers Inlet and Kitimat and all of them all the way down the coast, because this is where they come before they go to definitive care. It's really about time that Island Health looks at creating a hub on the north end of Vancouver Island. A hub where people can get services that are coming from north, that are coming from my territory and Kingcome Inlet and Guilford Island or the various other villages that are on the mainland. These are not issues that are easily solved, but when you look at the population density of First Nations people that you're servicing on the north end of Vancouver Island, it's huge. There are more than 10,000 Kwak, and 10 or 11 of those First Nations live in this area and depend on the North Island services. It's small potatoes when you look at, but when you look at your board members, they represent from Campbell River south. This is not reflective of North Island needs. You need to change that, and I plan to have a conversation with the Minister of Health and tell him, you're appointing people, but you're not doing it in a way that's effective for the people on the north end of Vancouver Island. Many people in this room won't know me because I left this community about, well, I'm sorry to say, about 50 years ago now. But I know a lot of people here in this community because I grew up here for some 12 or 14 years as a young person. The service here now, compared to what it was when I was growing up, is despicable. And that's not a nice thing to say. People move from this community because they don't have the services that they need, or they travel to definitive care in other communities in order to get those services. it's not, you can't say that you're providing equal services to the north end of Vancouver Island or to the First Nations in this territory when everybody else in BC doesn't have to travel. You know, even in the northern part of British Columbia, you've situated a hub where people can, and I'm not talking about Island Health, I'm talking about the health authority in general.
Yeah.
But the North Island is severely lacking in services. And it's everything that you do to create opportunity for people to come to this area, it's great, but it's not enough. So I just wanted to express those things. And they're really, you know, the biggest thorn in the side of First Nations people is the inability to effectively deal with racism, Indigenous-specific racism that occurs within the medical field. The other thing that I want to talk about is the ability for Island Health to put appropriate First Nations people in the positions that they need to do to bring services to each of the communities. It's not good enough just to put a brown face in a position. If that brown face is Métis and they know nothing about the Kwakwakiwak, it's not useful. And I've talked to Kathy about this, and I've talked to other people about this over a number of years. Look to the local people to provide, to fill those positions where, whether it's a liaison or whatever it is, because then you already have most of your training in place. Mm-hmm. People can relate to those people. People can, and those people who are working in those positions understand people don't have to tell their story over and over and over again. We talk about patient fatigue. That comes from having to repeat your story over and over and over again. So I just wanted to make those comments, and I thank you all for your presentations. It looks shiny and bright, but if you ask anybody in this room, I can guarantee you that they don't think that the health services on the north end of Vancouver Island are shiny and bright. Thank you.
Thanks, John. I just want to assure you that we do hear what you're saying, and that we will be speaking about that when we're not in an open forum, because, you know, we're kind of pressed for time and all that stuff. But thank you very much for your comments. We hear you. We will be talking about that amongst ourselves in the board, so thank you for that. Other questions? Hi.
Hi, my name is Eddie DeRose.
Do you want to just wait till the mic gets to you?
Thank you. Hi, my name is Eddie DeRose. Thank you for your presentation. What I didn't see on the presentation was some of the services that the children needs in the community. So because of the pandemic, we don't blame anybody for the COVID, but before the pandemic, there was a long list for children to get diagnosed with ASD, PPD, and so on. And then we had the pandemic. Everything got pushed back. And now we have youth that are turning into young adult, that still haven't been diagnosed. And some are walking around with BPD, anxiety, OCD, and there's nothing that we can do. We have a whole bunch of mental health workers in the community, but there's nothing for the parents that are taking care of all these. You know, we talk about beds being available for people with mental health, but nobody talk about respite for the parents that are taking care of all those kids. Nobody talk about respite bed for the seniors that the family are taking care of. Those are very important, because when you're taking care of a family member, you're the administrator, you're the driver, you're the nurse, you're the dishwasher, you're the cook, and the list goes on. And we really need, if we want to have a healthy community, in 10 years from now, we need to do something about those children. Thank you very much for allowing me to speak.
Thank you. Well, I can assure you that we are very concerned that we give appropriate care to children. And once again, not to keep repeating myself, but the purpose of us hearing from you is because we will go back then and talk about what happened at this meeting, how we can serve the population better. So thank you for your comments. Are there any? Here's a, yeah. I'm just going to get the questions.
So Bonnie Henry, in one of her interviews, said, "I am confident that all public health orders and in accordance with the law, including the Canadian Charter of Rights and Freedoms." I'm wondering if she was aware of the international military law of 1947 that states as the #1 principle, the voluntary consent of the human subject is absolutely essential. Free power of choice without force, fraud, deceit, duress, or coercion is needed. I lost my job because I wouldn't take the vaccine, which is now a bioweapon. And I was working with adults with drug and alcohol problems, and I lost that job, but I am allowed to work with daycare children and children with issues, disabilities, and I was able to do that, but not work with adults because I didn't take the jab. And that international law now has, is the Nuremberg Code, and that was created after World War II. So many people here are aware of that code, and many more people should take that code into consideration. Thank you.
Thank you. Go ahead, Mike. Thank you.
I just have a question. Of the 4 nurses that were hired for the Port Hardy Hospital, do any or all of them have emergency training?
I'm just looking to a staff person to answer that question. Hi, Leslie. Nice to see you.
Thank you so much for the question. So certainly a newly graduated registered nurse will not have emergency department training, and we have recently started a local program, and it was part of the funding that came to the organization last year that allowed us to start a local emergency department training program so that nurses who are hired into the area and don't have emergency department skills are locally trained. And our first cohort is actually in their training now, and we'll have another cohort starting in the fall. So while this slows us down just a little bit in having emergency department nurses, it ensures that we're able to provide that education for them in the local community where they want to work. I believe that the course is, it depends on how many mentors that we can have available for them. We're looking at about 12 weeks per cohort. And then of course, when we put nurses in a learning situation, we take them out of a working situation. So we have a balance to run in there as well. So we're putting through as many as we safely can to make sure that we've got other nurses staffing the rest of the building.
Port Hardy Hospital emergency would be open again?
Island Health is committed to having that emergency department open as soon as it can be safely staffed with doctors and appropriately trained registered nurses, yes.
Thank you. So I just want to go to a question that's been previously submitted, if I could. And the question is, where can I get my latest COVID booster or vaccine in Port Hardy? The nearest available appointment is showing in Alert Bay, but surely there might be somewhere more local.
Thank you for the question. This is a quick answer. So I'm assuming that person is going online through the Immunize BC portal system. So just to say, just keep going back and checking, because the system shows which vaccines are most currently available based on the number of providers in that particular site. But just keep checking, because there will be spots available within the community. I also just want to say right now, we're actually not promoting the COVID vaccine right now at this moment, because we don't have a lot of COVID activity, and the virus continues to change, and we'll see probably a new vaccine available in the fall that's lined up with what the current strain is. So yes, you can get your vaccine. You don't have to go to Alert Bay if you live here. Just keep checking the system. It'll happen. But I honestly, as a public health physician, my recommendation is you don't need to be in a big hurry to get it right now. Right? We'll make sure we let the public know when it's an appropriate time to make sure you get boosted. And it's not, the boosting isn't for everybody right now anyways. It's for people who are most at risk.
But the doctors and nurses have to have it? Why? They have to have it, right, to work here?
Yes, we're still under the the provincial health officer's order, so that's the legislation that guides all of us as employers. It's part. Well, that would be a question for our provincial health officer.
And do you ask that?
Yes, we continue to meet to talk about what the appropriateness of the requirements for occupational health. Pardon me?
What have they said?
So far, it's still required, yeah.
And the reasoning being?
So, I appreciate what you're asking for, but really you need to direct your question to them, because we can't really, we can't really answer your question, because we are under provincial orders to do that, as is every other health authority in the province. So really, if you want an answer to your question, you need to direct it to the province.
So I gave it the wrong meaning.
Thank you. Do you want to? Thanks, Mike.
Hello? Yeah. Hi, I'm Blair. My mom was raised in Kincomilet, so I'm well connected to but I live off in the woods, and it is really nice to be in a room without a single mask, with no 6 foot distancing, and I didn't have to give any contact information, and it makes me feel like the pandemic is over. Is it? When did it end? Does somebody know? Last year it was declared over, but we're still under the rule that we have to have a vaccine to work in the hospital. You have to have a vaccine shot to work in the hospital.
So
I just wanted to clarify what you said was you're not the authority, even though it's actually Island Health Authority, Vancouver Island Health Authority. You represent the authority from the minister, and he gets his authority not from the medical profession, not from licensing, not from any knowledge of health at all, but from an elected premier who is good at government bureaucracy, must have incredible skills at running a government, but he has no health training either. So he's the one who's in charge of the people who are in charge of you that you can't talk to. And we're trying to talk to you.
Well,
so
we appreciate,
we can't talk
excuse
to you,
me,
you can't talk to them.
We appreciate that you're trying to talk to us. But we are abiding by provincial law, as are all the other health authorities in the province. Anyone else? Because I've got another question from the... Okay, go ahead.
I just would like to really encourage Island Health to get that phone number and the information out about the shuttle service here from
yeah.
Port Hardy?
Yeah, we heard
As
that.
soon as possible,
Yeah,
please.
great, thank you. I think Marjorie was pretty clear about that. So I actually don't have any more questions, Mike, from that were submitted before. Are there any other questions? We've got about 5 minutes left. Do you want to just use the mic?
Thank you. The shuttle service that they have, is there someone on there that is also paramedic, or if there's an issue between here and Campbell River that they can look after the people that they're taking down to the hospital? Or is that just a driver in the bus that's taking them there?
Can you answer, Mike? Max, thanks.
Yeah, thanks very much for the question. So the shuttles are drivers that are moving up and down the island. They're also moving people and staff, so there may be times where we have people that are moving across communities that'll be with a staff member, and they're also part of our logistics, so they're also moving supplies and products as well up and down the island. And then in terms of being able to access the schedule, and we can share this, there is a phone number that we've launched within the last 4 months where if individuals are looking for access to be able to move across the health system for care, they just phone the 800 number and they'll be able to speak to somebody who is an expert in understanding where they are and what type of services are available for them for transport. So sometimes it's the transport network that Island Health has set up, or it could be transport options through the ministry or other avenues as well. So we have somebody that's available to just speak to people. They just have to call the number and it's available online.
Thank you. Time for one more. Does any? Here you go. Thank you.
Hi, everyone. I'm Anas Tuer. I'm a family physician working in Port MacNeil. First of all, I want to thank everyone for being here today, the public and the board. I want to thank the board member that brought up the idea of having succession planning. I think that's very, very important, and it should be taken into great consideration. Time would not fit for me to talk, about a lot of things that are going on. But I did promise one of my patients that I would bring this up once I had the chance to, and it just because they were talking about transport, I remembered. So I had a patient who had an incident where he had vascular surgery down in Victoria.
Would you mind holding the mic up to a little bit closer?
Yeah.
Great, thank you.
So, who had surgery down in Victoria, used the shuttle service, which is a great service. And I thank everyone behind it. But for some reason, he was taken from site to site to bring him all the way back here. But on one of the sites, they told me that they left the shuttle unsupervised, didn't know where to go, didn't find anyone to talk to or figure their situation, and no one knew what they were doing, and they had very serious surgery. So I told him I'll bring that up. There must be some confusion or something that can be done about that. So just to bring that up. But all in all, I just wanted to thank everyone for being here. I think the most important thing to solve any issue is for everyone to gather and talk about it. That is the most civil way of doing things. And just to let you know, there's always going to be issues, but if we all collaborate and come together and have, a space where we can all share how we feel, I think we can reach a solution. I think we should always think about the future, if we have any kind of suffering, I don't think we want that to happen to the next generation. So everything we do, I think we should think about in the number of years, like in 10 years, 20 years from now, how we want this to be better. Thank you, everyone.
Great. Well, that's a very good spot for us to end. Thank you for your remarks. And thank you to all of you who came tonight to hear our presentations. And for those of you who asked questions, appreciate that you did that as well. Kathy, Charmaine, and Marjorie, really appreciated what you said to the group. And so the forum is closed. Thank you for taking the time to join us today.